I've taken care of teenagers for the last 30 years, and one thing I can tell you is none of them want acne. Not a little or a lot of acne. But what happens is that sometimes parents are kind of busy and they don't really notice that your acne is getting worse and worse, and it's getting thicker, and you may have lesions the size of blueberries over a lot of your face or your chest or your back. When it comes to your skin, no one wants to look in the mirror and see more pimples pop up. So if you're dealing with acne, first of all, try the over-the-counter face washes. The ones that have benzoyl peroxide in them really work well. You can also get over-the-counter Retin A. That's a very low dose, and you can try it because it's a natural exfoliant and it will help get some of the oil out of your pores. But if you're finding that the over-the-counter remedies don't work, then it's time for you to see a specialist in the skin. Now, that could be a dermatologist or a nurse practitioner who specializes in dermatology. And when you see them, they'll take a complete and thorough history, and then they may prescribe a prescription face wash that you get at a drugstore through the prescription. And it may have salicylic acid or a stronger dose of benzoyl peroxide. They may also prescribe a little bit stronger or more potent Retin A product for you. And when you do that, you have to have a good skin regimen, right? So you're gonna wash your face twice a day and use the products as they're designed. But what happens if it's not getting any better and your acne is getting worse? And maybe it's spreading to your back or your chest, or a lot of your face is covered by these large, very painful pimples that are reddened and sometimes have a little bit of a yellow crust on them. You may have also noticed some blackheads. If that's happening, talk to your parents or your caregivers about seeing your healthcare provider again. There's an old saying called the squeaky wheel gets the grease. So if you're not complaining, people go on with their own lives and they may not know that this is really bothersome to you. So make sure you use your voice and be heard and say, you know what, I need to do something about this acne. Because if people have cystic acne, they can often get scarring or small pits in their skin. And that is something that we want to avoid. Oftentimes, if the face washes don't work, then your provider will prescribe an antibiotic to take by mouth. Usually it's tetracycline or doxycycline or something called minicin or minocycline. All of these work to decrease the bacteria that can be growing in the pores, causing that cystic acne. If you're using one of those antibiotics, be sure to stay out of the sun because it makes your sun very, very light sensitive and you can get a very bad sunburn. If you're taking those medications and you're not noticing an improvement, then your provider may suggest a medication called Accutane. Accutane is a very strong vitamin A derivative, and Accutane is reserved only for people who have the most severe acne, but it can be used at the beginning when people notice that there's a lot of acne developing, or when they've had acne for 3 or 6 or more months. Accutane is very, very effective. And if your prescriber asks you to use it, they're first going to want to do some blood work. They're going to want to make sure that your body is healthy and that especially your liver is healthy. So they'll be checking your liver function because Accutane is metabolized by the liver. They'll also ask you, if you're a woman, to sign something called I Pledge. I Pledge says that I pledge to use reliable contraception, usually the birth control pill and condoms if you're sexually active. They will also ask you to have 2 pregnancy tests to make sure you're not pregnant before they prescribe it. Why do they do all of that? Because Accutane can cause birth defects in developing babies. So women who use Accutane should absolutely use reliable contraception or not have sex. The next thing is they're going to advise you not to drink alcohol during the 3 to 6 or 9 months that you're using Accutane. because alcohol and Accutane are both metabolized by the liver. And if you use both at the same time, and I don't mean you take your Accutane pill and you slug down alcohol. I mean, if you're drinking alcohol during the day, at any point when you take Accutane, it can cause liver damage. So be sure to limit and avoid all alcohol if you're taking it. So what happens when you use Accutane? Well, it's a vitamin A derivative. It's called isotretinoin. And what it does is it reduces the oil production in your glands, the glands on your skin. But it also shrinks those glands, so it kind of forces the oil out. It also helps exfoliate the skin. It helps with natural turnover of dead skin cells. It's kind of like exfoliating and asking your skin to regenerate new healthy cells that don't have as much oil. Many people who use Accutane need to take it for 3, 6, or even 9 months. It's a pill. You take it by mouth with a big glass of water once a day. When you first start taking Accutane, what can you expect? Well, you may notice that your acne actually flares up. What's going on there? The reason is that all of that natural exfoliation is causing the oil to kind of flush out of your pores. So you may notice a little bit more acne before it gets better. The next thing is that over time, those acne sores are going to get smaller and smaller. Your skin will heal, and then for the most part, it can become very nice and clear. And it can also reduce the appearance of some of the scarring and any pits that you might notice in your skin. So people are evaluated regularly by their healthcare provider to see how they're doing. And then what happens is that they stop using Accutane after about, again, 3, 6, or even 9 months. But what happens if you stop Accutane, you do well for about 3 or 4 months, and then your acne gets worse again? Yeah, you can take another course of treatment that's safe for your body. So the take-home message here is, sometimes when it comes to your body, you have to be your own best advocate. I've known many, many teenagers with great parents and caregivers, and the parents and caregivers were really busy and they didn't notice that their child had severe acne. And sometimes parents don't know what to do. They figure, well, this is just part of being a teenager. But it's not part of being a teenager to have severe cystic acne that covers even more than like a quarter of your face, because you don't want to have that scarring that can last a lifetime. I hope this helps answer your questions about Accutane. Please click like and subscribe and leave me a comment or a question or any other topics you'd like me to cover in the future. Take care and be well.